I'm Jason Blake, I'm the Medicare Geek. My goal is to help clients succeed with Medicare and to help agents like me who help people with Medicare grow their Medicare Advantage book to at least 500 or more people. This video will not be interesting to a general consumer. This video is for insurance professionals who want to market Medicare products. It's also for insurance agents or people who are potentially want to become an insurance agent in order to work with Medicare clients. Okay, so let's talk about it. Medicare Advantage. Most of the national carriers like UnitedHealthcare, Humana, WellCare, for a new Medicare Advantage plan, never been in Medicare before or on Medicare Advantage plan, starting on January 1st, they pay a commission of $4.55. Now, if it is somebody who is who's already had a Medicare Advantage plan and they're changing from one Medicare Advantage plan to another, it's exactly half that. So let's do the math. $4.55 divided by 2, $227.50. So how does this work? Okay, so if you sign someone up during open enrollment and they're brand new to Medicare, for January 1st Medicare Advantage enrollment date, they are going to get a commission of $227.50. And then within the next month, they're going to get another $227.50 for a total of $4.55. And that's their commission for that first year of Medicare Advantage for the agent. After that, really with most of the companies, they're doing lifetime renewals. After that, that half figure becomes the annual renewal. So that means in year 2, you would get $227.50 divided by 12. So every month for that one person, you would get approximately $18.95 every month. January, February, March, April, May, onward until by the end of the year you had been paid $227.50. Now let's take somebody who's already in Medicare Advantage but they're changing plans. Say somebody's with WellCare and they decide for 2018, 2019, they sign up in open enrollment, they want to sign up with WellCare for January 1st of next year. You move them from one Medicare Advantage plan to another. That next January, you're going to get that one-time commission of $227.50. $227.50, excuse me. That's your commission for that year. And then year 2, year 3, year 4, year 5, most of the companies out there have gone to lifetime renewals. So what that means is it'll be divided monthly, but every year you will get that $18.95 every month for that member. And most of the major carriers have gone to lifetime renewals. So that means technically if the plan stayed around 30 years and the person stayed on that plan 30 years, you could get those renewals for 30 years. Most likely the Medicare Advantage plan only has a shelf life of 4 to 5 years, and then you're going to have to change them to a new plan or give them a new setup, something like that. But it's still a nice time to look at renewals. So let's talk about the value of 500 or more. The reason my goal is to help agents get to 500 or more, let's look at what happens to your renewals when you hit that. So say it took you 5 years to get to 500 Medicare members. So that would mean your monthly renewals would be this figure, $18.95. $18.95 times 500 people would mean you would have monthly renewals of $94.75 every month for the whole year, as long as those members are in the same plans. That's why it's so valuable to help a new agent get to 500 as soon as possible, because then they have an incredible renewal income and they can continue to build business. Imagine if somebody gets to 500 members or more, and then every month they sign up 10 new people for Medicare Advantage. So what that means is, month 1, if they sign up 10 new people for January 1st, that first month of the year, they're going to get $45.50. Second month of the year, they'll get 11/12 of that. So in February of that year, if they signed up the next 10 people who were brand new to Medicare Advantage, that commission would go down to $41.70.83, and it reduces all year long until, last month of the year, you'd be about $31.09. However, every one of these new people starting the next January, so for these people the very next month, that renewal of $18.95 would begin again. So if you've written those 10 new members every month of that next year, you would then have 620 new members after this 500 at the beginning of the next year. So let's look at your renewals would be like for that. 620 people times $18.95 a month. Your renewals monthly would be $11,749 per month, all year long, every month, for as long as those plans go on. And you have the same option to write at least 10 new Medicare Advantage members every month. So this is why my goal is to help new agents get to 500 or more Medicare Advantage members as soon as they can, so that they can have a monthly renewal income of this amount and growing, and continue to build their business and help other people. You see a lot of other insurance opportunities, you see multi-level marketing opportunities where you see numbers like these, but then you really don't know anybody who is making that kind of money. This can be verified with Medicare Advantage. Personally, I can verify for people that I'm earning this amount of money, not off people I've recruited, just off the membership base that I've built, and I can also introduce you to other agents who built Medicare Advantage books the same amount. A couple caveats: a couple of states pay a little more, a little less than this $455 for a new enrollment, and then also sometimes regional carriers, Blue Cross Blue Shield, sometimes Kaiser, they will pay less commission, but usually there's either such an advantage or there's either such a pro to having that plan in that marketplace that it's worth getting a little less money on it, maybe for a few less years renewals, or there's really not much value in being a carrier for that product anyway. So this isn't a locked-in fee, but I've been in the business since 2009, and this number has gone up from Medicare every year. When I started, it was about $350. So this number does continue to rise on how much you can make per year per client. That also means that my first clients that I signed up that are still members of mine, I'm not making that $18.95 per month. For many of those, I'm only making $15, $16 a month. So my 500 members might not pay me quite this much, but it's still not an embarrassing amount of money to earn. So this is the power of Medicare Advantage. Not only are you earning great income in a world where there's limited opportunity for working class people, you're also helping people with services that they need anyway. Nobody gets to age 65 and says, I don't need medical anymore. These are services people are going to need, and they need someone to help and guide them through. It's also an opportunity for you to have a great income, be a valuable part of your community, and to help people take advantage of their health care in a way that is most empowering to them. Stay tuned for more lessons from the Medicare Geek.